I play tennis at a high level. Everybody I play is younger than me, and I play about 5 to 6 times a week. I tore some muscles in my shoulder, and I was very sedentary for several days. I was sitting on a plane for 18 hours, fishing for 4 days, then again sitting on a plane, then sitting in my office and going to surgery, and that was very atypical for me. 2 days after I had my rotator cuff repaired, my left leg started swelling and there was intense pain. It started turning dark. I was kind of ignoring it, thinking it would just go away, and then the day after it started, I tried to walk up the stairs, and I got to the top of the stairs and I couldn't breathe. I called my doctor and told him about it. Told him I just had surgery, and he said to get in right away. They did an ultrasound, and I waited in his room, and he came back and he said, got some bad news. You have extensive multiple PE in your lungs. And apparently, because of the DVT in my left leg, which extended from my ankle all the way up into my left groin, these PEs broke off over the 2 days since I had my shoulder surgery and lodged in my lungs. And when I tried to walk up the stairs, I couldn't catch my breath. And so they put me in a wheelchair, and he was right next to the hospital, and they rolled me over to the hospital, put me on a heparin drip, and I spent 2 days in intensive care and started treating the DVT at that time.
He came in actually in the middle of the night with significant swelling in his leg. So there was certainly some concern. I knew that there were some treatment options for him, but because he had had recent surgery, it was something that we would have to think about. He ultimately decided to have the clots in his legs cleaned out, and we were able to do that successfully over the course of 2 days.
And so he did 2 procedures called thrombolysis. It's sort of like, for laymen, it's where you go in and scrub out the vein or the artery, sort of a roto-rooter procedure to increase the circulation. And it worked out very, very well.
His swelling went down immediately. He was able to walk without much difficulty.
There are no issues, no swelling in my legs. I had no idea that this could happen after you had surgery. So if you go in for any kind of surgery and you have any swelling in the extremity, call your doctor right away and get help right away.
You're looking at dire circumstances if an intervention isn't undertaken soon.
I told him how important tennis was to me, and I was very, very concerned about being able to play again without any residual pain or swelling. I think just treating it aggressively and listening to your doctor was the key.
He was able to resume playing the thing that he loves the most, and that's tennis.
Playing at 6 a.m. in the morning, 5 to 6 times a week. You know, got a great result. I'm very, very fortunate.